Good day, ladies and gentlemen, our dear audience. My name is Ibrahim Murtala Muhammad, and I'll be your host for the podcast titled The Next Question, brought to you by the Sustainable Development Conversations Initiative. And today, here with me in the studio is Ms Khadija Ibrahim, and she is a public health practitioner. And the topic of discussion today here is zero doses zones in Bauchi State. So the Bauchi immunization coverage crisis. So every day a child is born, and not just one, not just two, but hundreds of them, and most of them go unvaccinated, not at birth, not at 6 weeks, some of them not even ever entirely. There's a term for them. They are called zero-dose children. And in 2024, 13 of Bauchi State's 20 local government had high concentrations of them. Nigeria has been declared free of the polio virus in 2020, but in 2024, another strain emerged, and we are back to fighting it. So today we are going to answer the most prevalent question of what is vaccines, and what is the implications of having many children go unprotected from these diseases, and what does it mean for diseases without we have already beaten coming back to life. Thank you, Ms. Khadija.
Thank you for having me. My name is Khadija Usman Ibrahim. I'm a public health lecturer, and I am a staff on a non-governmental organization. And we are going to discuss about the zero dose. Zero dose actually isn't an old term; it's a new term for actually an old problem. So let's dive into a real life scenario so that we understand broader what does zero dose means. So let's imagine a woman been living in a hard to reach area in this rural district, where she has given birth with the help of a traditional birth attendant with zero contact to the health facility. And that woman, having born a healthy child, sees no need for them to visit the health facility for her to even discover the vaccines. And the system and the health facility, being kilometers far away from the district, did not have contact with the woman. So that child goes undocumented in any health facility vaccination record. So this woman, not because of not loving her child, but because of sheer ignorance, leaves her child without vaccination. And let's say we have a measles outbreak, and that child in a neighboring town, and that child gets in contact with that measles. So that child is what we call the zero dose child, a child that has zero routine vaccines. And we quite have them in Bauchi State, as the World Organization have flagged almost 13 LGS out of the 20, which is a very serious issue. Those 13 LGS include the Turu, Shira, Al-Galeri. Those areas have hard to reach areas in which either the facility has failed to reach them, or the parents are non-compliant with the vaccines.
Okay, that's good. I remember vividly last week we spoke about the postnatal care with when we were discussing the reasons for child and maternal birth, and thank you for giving us this broad definition of what is a zero dose. Can you please just state for us the gravity of that in the society? So women not having their children vaccinated, what is the broader consequences of that in the society?
So the a broader consequence is an example of the polio vaccine we have now. So we have it is termed that Nigeria has eliminated the polio virus. Yes, it is true. In 2020, Nigeria has eliminated polio virus, and we are still having routine vaccination of polio, of the polio. why. People are asking why, and the main reason is because of these zero dose children. These children are not reached. So the wild polio is not active anymore in the country, but there are a certain group of non-vaccinated children which, after a small group have been vaccinated, the vaccine mutates and give birth to another disease. So that hence, the World Organization want to reach a larger audience of children, reach most of the children to get them vaccinated.
Okay, thank you very much for that. So Penta 1 and Penta 3 coverage below 40% in some areas. So what is Penta? Why does it matter? And why is there, and what does a gap that wide mean for the child's chances of living or in life entirely?
So let's start by knowing what that Penta is. Penta, formerly known as the DPT, we all were given DPT in our young age, which is the vaccine giving protection against the diphtheria, pertussis, and tetanus. So years later, it is now given protection against 5 killer diseases, which is diphtheria, pertussis, tetanus, and Haemophilus influenza type B, and also hepatitis B. So this vaccine has kind of a high adverse reaction, which when given to a child, the child develops fever, and sometimes the place of the injection swells and so on. So having this, our mothers think it is love by not taking the child back to the health facility to receive the second dose and the third dose. So the first dose is mostly given to the children, which give almost 40% protection against these 5 killer diseases, and our mothers think that one dose is okay, has the enough efficacy to cover everything, without knowing that only that one dose could lead to another problem. Could just give partial protection against those 5 diseases. And the first dose is given at 6 weeks, the second dose at 10 weeks, and the third dose at 14 weeks. So mothers seeing this adverse reaction following immunizations usually refuse to bring their child to the health facility to receive the other doses. So that brings to high rise of unvaccinated children against these 5 killer diseases.
I get. So for us to get a little bit in depth into the problem, we found out that some facilities might not be able to have or even keep those vaccines. As we all know, vaccines are kind of tend to be useless in heat. It breaks down. So how reliable is Bauchi State's cold chain and the ability for the state to store these vaccines in those hard-to-reach areas that you stated? I believe you've already given the context of how dangerous it is to have areas that are not covered. So how do you think Bauchi State cold chain is that reliable in that aspect?
So having seen it with my own eyes, Bauchi State cold chain is actually reliable right from the central stores down to the health facilities, down to the community where the health workers carry the vaccines in ice packs and coolers to reach the unvaccinated children. So this shows how reliable it is. And also, if you see every health facility, no matter how big or small, every primary health facility has been equipped with solar systems where the refrigerators are kept cold, since any vaccine kept warm or in heat is regarded as dangerous or even lethal to the health of an individual or child.
And there is this misconception, especially in the northern part of Nigeria, so either community resistance or religious resistance to vaccine. So how significant is it in Bauchi? They will say that something like that. So how is that, how prevalent is that in Bauchi?
So I would say this problem is mostly coming from us, the health workers. If you do a community entry properly, meeting the community leaders, the religious leaders properly, you tend to have more perfect reach to the audience you are targeting. rather than meeting the audience directly without doing correct community entry. So it shows that our community leaders, religious leaders have a big role to play in this vaccine and all sorts of this.
Okay, I understand. So who is actually kind of administering these vaccines? Like, who's responsible for that at the PHC level, and what do they actually need to do their job properly?
So at the PHC level, the community health extension workers and also the nurses take part in vaccinating the children. And also at the field level, the community health extension workers also go to the field to administer it to the children. Example, the polio vaccine, which is given house to house, but the other vaccines given at the facility level are mostly given by the nurses and the community health workers. That's the choose.
But how do health workers know that a child or children have been vaccinated or not? Is there a system where you can identify all of these invisible zero-dose children, where you can kind of actually find them and do something about that?
So thankfully, these zero dose have been captured by the World Health Organization. There is an electronic record that they keep, where every child is being recorded in that system. So the health worker at the point of delivering the vaccine to the caregiver, to the child and to the child, they have the record of the child, they have the number of doses the child have been given since birth, and also things like that. At the facility level, they do have their vaccination cards, where if lost, a caregiver or a mother can recall what vaccines they have, and they also have their tally books that record the names of the children being given this the particular vaccines. And also the system is designed beautifully, in a sense that if you live there, for example, you're traveling, you have your vaccine card, you can take your child to a health facility, a nearest primary health facility, where the child can be given their vaccines. So that's how the system is designed.
Okay, I understand. But based on your description right now, it kind of seems like most of the system is still working on paper and pen. Is that true, or the system has been digitized? If not, what do you think about that?
So parts of the system have been digitized, and like I said earlier, the system where the house-to-house delivery of the vaccines are conducted are all been digitized. So there is a central office where all this information are stored. So at facility level, I would say it is based on pen on paper basis. They have their registers there, and the caregivers have their cards.
Yeah, I think let us stop there for the system of how the vaccination works. Now, I want to ask you, what are the major issues that vaccination is facing in Bauchi State? We already touched a little bit on religious and communal resistance. We already also touched on maybe lack of awareness and sensitization around the topic. So what other thing do you feel contributes to the creation or making of this zero-dose children?
So mostly it's non-compliance from the caregivers. I have an evidence of this non-compliance. I went to a community to supervise the vaccination, to see if the vaccine has been reached. Quite okay, the house has been marked that the vaccine was not given in that house, and it showed non-compliance. So I went to the mother directly to ask her, have your child received vaccine? What she replied was yes. When I told her, I know I have the records that your child have not received any vaccine, she said they don't take vaccine in their family. So you see, we have a gap to reach for these children to reach the vaccine. And also the World Health Organization have the non-compliance committee, where they reach the community leaders as well as the parents that are non-compliant, educate them about the importance of the vaccine and also the dangers of not vaccinating their children.
Yeah, I understand.
Yeah.
So, beyond polio, what other diseases are at risk of resurgence because of the low immunization coverage here in Bauchi?
Diseases that are at the risk of resurging include diphtheria, where I was living evidence of the diphtheria, where it claimed the life of an 18-year-old. And also, if you have seen the data and also tabloids from news, you would see that from Aliko Dangote College of Nursing, there was an outbreak, there was a case. Since if there is a disease like that, one case is an outbreak. So they did contact tracing, they isolated the students who had contact with the confirmed case, and also they treated it. So if we see this kind of things in our community, that shows there is a risk of resurgence of those diseases. And since these diseases claim the life of an 18-year-old, which is stamped as an adult, what would that disease do to a child? So looking at this, the government were so active and against that disease. And also, if you see measles too, it is at the risk of resurging. So there was an integration that occurred against the vaccination of rubella and also measles, which was done house to house. Almost every child was reached in that vaccination.
I understand. So can you paint us a very small picture of the immunization coverage in the state?
So based on data available, only 1 out of 3 child is being vaccinated in Bauchi State. So which is a serious case, which is the leading cause of this zero-dose case. 1 out of 3, which means almost 1 out of 4 is not vaccinated. So this can lead to resurgence of many killer diseases among the children. Children being born in hard-to-reach areas, parents being reluctant of bringing their child to continue the vaccinations. All these problems are high leading problems to these issues. If it is not tackled, it will be a big problem, really.
The speaker from last week spoke a lot about antenatal and postnatal care, and I believe it is part of the reason why the immunization crisis is also stemming from. A lot of ladies will give birth to a child and imagine that everything's okay. Yeah. So I think that's that. Shifting a little bit from the core of the problem, I believe we've spoken about the problem extensively at this point. So looking at possible solutions for the outlook of the problem, what are the solutions that you think you can prefer to either the government or the NGO or even the general audience on that? So maybe 3 or 4 solutions that can go that way.
So regarding these problems, being a large scale of problem, there are solutions. The first solution is bringing the clinic closer to the people. In these hard-to-reach areas, we equip to the government, to the federal and state government, we equip health workers, give them vehicles that will deliver them to the hard-to-reach communities to give the children that are not reached with the vaccines. Secondly, educate mothers. And also, if a mother gives birth at home, the child should be documented, even by a traditional birth attendant. The traditional birth, there was an effort that was made to equip traditional birth attendants that conduct births at home to record births conducted so that they will register them at health facilities. So I don't know where this progress lies. And also, if a traditional birth attendant will conduct a birth at home and document the child, and also encourage the mother to bring the child to the health facility, this will be a great step towards ending the zero-dose case. And also, if people in the community will be equipped, will be trained to learn about the vaccine, how to deliver the vaccine, those vaccines that are can be delivered by normal people, not by health workers. If they will be trained to give this, they know their community, they know where have been reached and where have not been reached. They know everybody in the community. That will help really well in ending zero dose. And also, if traditional leaders and religious leaders will dive into the problem. Their words are more than the words of the government to the people.
Yeah, precisely.
Yeah. So if the traditional leaders will educate husbands in their mosque, in their gatherings, in their churches, then zero dose will come to an end.
I understand. I believe these are kind of clear action points for trying to tackle that problem. You also spoke about training community members. I'm very sure a lot of other organizations probably have done that. And you going to, or you having contact with those communities, how effective do you think that that approach is? Or do you think the approach is good, but the techniques of that should kind of change? What's your take on that?
Yeah, let's cite an example where an indigent of that locality is being trained to give a vaccine to a child. That indigent knows every nook, every corner of that locality. So he knows where to go and give the vaccine. He knows how to report non-compliant. He knows those people that will not comply with receiving the vaccine. I'll cite an example again where I went for a supervision, and I saw any locality I visit that this community drug distributors are indigents of that locality. The vaccination was near to perfect. And any locality I visit that the community drug distributors are not indigents of that locality, there was almost low that gave us the lowest coverage of vaccine.
Okay.
Yeah.
I believe these are very, very important data points.
Yes.
For anybody that is, let me say, the government trying to tackle this. I don't want to call it pandemic, but let it stay at the epidemic stage. So the next question that I want to ask is, can health workers realistically track children who miss doses and bring them back? What would it take to make that work at scale? Earlier, you gave an example of on the health workers' diary, stated that it is a non-compliant house, but then the mother said that they've already done the vaccination or something thereabout. So how can health workers realistically do that tracking, and how can the government deploy something like that at scale?
So I don't know if you have heard about a non-governmental organization which gives mothers cash incentives if they give their children a vaccine, and at the end of the vaccination, if a mother or a caregiver completes her child vaccination, they give her some amount in cash. So that non-governmental organization have really helped in tracking missed vaccines among children. So the mothers are eager to bring their children to health facilities, and also in house-to-house vaccination delivery, then the app used have been tracked, where if a child is not at home and at the point of vaccination, they indicate, and also from the head office they can track down that child, track the health worker that visited at that day where the child was not there, and also inquire if the health worker has revisited the house to give the child the vaccine. So this avenue, so both the non-governmental organization and the tracking system, if they are active for a long time, that will really help in ending this problem.
I think one thing that kind of interests me is the cash incentive part.
Yes.
That an organization is handing out to mothers. One thing that I kind of a bit skeptical about is, don't you think that what is kind of the risk or the possibility of these mothers giving the system to get the cash incentive?
So the system is designed beautifully in the sense that it cannot be rigged. The non-governmental organization, as far as I know, they do auditions, they hold audits, They track every worker they send to a facility. They track them, how good is they working, and they always reshuffle the workers so that they don't get used to a facility to open a door for any bribe or anything of that sort.
Okay, I understand. Yeah. So out of the 13 LGS that were flagged in 2024, is there anyone that is being held accountable for that, and what are they doing about it?
So at the national scale, the state being held accountable, the state executive chairman of the primary healthcare hold the directors of the primary healthcare for each local government accountable. The director of the primary healthcare for each local government hold the ward focal persons of those settlements not reached, so that to ensure the children are reached to end this zero dose.
Okay, thank you for that outlook. So if the Bauchi immunization crisis continue at its current trajectory, all of the percentages that you gave, all of the numbers that you gave, if it is to continue, what are we looking at in 5 years? Just a short projection on your side.
So I would say if the system continues the way it is, by going to community, doing mobilization and advocacy to end this zero dose, if it continues the way it is, the strict procedures that are being conducted, the non-compliance committees, the executive chairman being strict to those problems, if it continues, in 5 years we will have no zero dose. And also the UNICEF and the World Health Organizations tracking down children that are missed, conducting regular sensitization sessions to community leaders, to the community at large, to mothers and caregivers. We will not see anything like zero dose again.
So if you are given a single superpower, an ultimate one, to eradicate this crisis, what is the first thing that you do? You mentioned a lot of solutions and a lot of problems, but what do you think the first thing that should be done, or the most important of them?
The most important one is meeting the caregiver or the mother who is closest to the child that is not given that vaccine. So if I was given that superpower, I would educate a mother at every single health facility and at home through radios, banners, leaflets, sharing them during sensitization sessions, antenatal immunization clinics. I would encourage them to take this vaccine, tell them about the dangers, tell them about the risk of not getting those vaccines, tell them the good part of taking the vaccines. They could see during an outbreak, any mother who has vaccinated her child is barely worried about her child being contracting that disease in the case of an outbreak. So I would encourage them, using those scenarios, using case studies, to take the vaccine. And also, after mothers, the traditional rulers, like I said earlier, to tell them to equip the people with knowledge about the vaccine too, and if possible, I will also give the mothers incentives, just as the other non-governmental organizations are doing, as incentives has shown a great power in changing the mindset of people in most cases. Yeah.
I understand. So thank you, our dear listeners, for joining us today in this wonderful session on zero dose crisis around the state, where we discuss issues around the vaccination that is happening across the state, the resurgence of killer diseases in children and possibly even adults, and how important vaccination is. I believe historically we've been having a lot of outbreaks, such as the bubonic plague, the measles outbreaks, and all of that are wiped out a lot of communities in the past. But due to vaccines, all of these are history are just a page in the history books. And I believe if we are to continue in the trajectory of tracking every single child that is born and every mother that gives birth to eliminate the zero-dose children in our society, we also are going to record all of these diseases as a page in history. Thank you very much for taking the time out and listening to us, and see you on the next one.